Hi, everyone. Today I'll be presenting on combating COVID-19, what the eradication of smallpox can teach us. Before I begin, I'll just give a brief introduction of myself. My name is Sohani Sandhu, and I'm a rising senior from Arizona College Prep in Chandler, Arizona. My interests include scientific research, tennis, and volunteering. I've done multiple research projects in the past, one including the development of a heat stroke prevention device, which has gained support and grants from MIT, Arizona State University, and many other organizations. In the future, I hope to pursue a career in either biomedical research or public health research, as those two are very big passions of mine. So just to give a brief roadmap of my presentation today, first I'll give an introduction of the topic at hand and why it's important. Then I'll describe the current state of COVID-19 as a pandemic, and then talk about the history of smallpox, both what it was and how it was eradicated. Then I'll compare the two before finally explaining what we can learn from the smallpox eradication programs in order to help us with the COVID-19 situation at hand. And that'll take us to our conclusion. So what am I presenting on and why is it important? So today I will demonstrate how we can take lessons learned from the smallpox pandemic and apply them to resolve the COVID-19 pandemic. As we all know, the COVID-19 pandemic has led to the loss of millions of lives, and it's very important that we help resolve it as soon as possible so that we can minimize the amount of lives lost in the future. As smallpox is the only human disease to have ever been eradicated, it's important to take into account all the strategies that they used in the past to defeat it in order to defeat COVID-19 at the moment. So what is the current state of COVID-19? So recently, the number of new COVID-19 cases continues to decrease. The rate of growth continues to decrease, but there still are millions of cases worldwide, specifically centered in the US, Brazil, Russia, and India. So now I'm going to give a brief history of smallpox. As a trigger warning, there will be a picture of a smallpox patient, so if you are squeamish, you might want to look away or be prepared. So smallpox is an infectious disease caused by variola major and variola minor, which are two virus strains for the disease. Variola major is shown on the left. It is highly contagious. Each patient can spread the virus to 3 to 6 other individuals. Usually the way the incubation for this virus works is that once the individual is exposed to the disease, within 12 days, they begin to get symptoms such as vomiting and fever. And once that fever starts, that means that they're contagious and they can spread it to other individuals. From there, they begin to develop rashes and fluid-filled bumps, which is the most common symptom and most widely seen symptom of smallpox, as you can see on the right. And that can lead to fatality in 30% of patients or disfiguring scars after survival, if you survive. Smallpox has actually existed for at least 3,000 years. The first written record that has confirmed the existence of smallpox, that was for sure smallpox, was from 4th century CE in Imperial China. And ever since then, there have been major outbreaks all across the globe, including in 1796 when Edward Jenner created the first vaccine. The way that he created the vaccine was that he used cowpox to prevent smallpox. And the reason why that worked was because cowpox and smallpox are from the same orthopox virus family, meaning that they have similar genetic makeup, but cowpox has much milder symptoms compared to smallpox. That way, when Edward Jenner inserted the cowpox pus into individuals and vaccinated them, they got symptoms from cowpox and they healed from cowpox, but they also gained immunity from smallpox as well. So now I'm going to compare COVID-19 and smallpox. So smallpox and COVID-19 have pretty similar incubation periods. Smallpox has an incubation period of 12 days, and COVID-19 has an incubation period of 2 to 12. Smallpox only spreads once fever develops, whereas COVID-19 can spread 2 to 3 days before symptoms start. It can also appear as asymptomatic in some individuals, which does make it difficult to keep track of who gets exposed, as sometimes it doesn't appear on time. So you always have to get a test for COVID-19 to make sure you have COVID, whereas smallpox, you didn't need a test. You could see when a person has smallpox. Smallpox is also spread through person-to-person contact and bodily fluids, and COVID-19 is spread through respiratory droplets. Smallpox has an R0, or a basic reproductive number, of 3.5 to 6, which means that one patient can spread it to 3 to 6 other individuals, whereas COVID-19 has an R0 of 2.5, so it has much less contagious qualities compared to smallpox. One unique feature of COVID-19 is that it also is from an animal reservoir, meaning that it came from an animal. So if we were to attempt to eradicate COVID-19, we couldn't possibly likely couldn't eradicate it from the actual animal reservoirs and make sure that it no longer exists, but we can definitely work to contain it within the human public. So what strategies can we take from smallpox eradication process to implement in the current COVID-19 pandemic? Well, one of the main things is vaccination. Edward Jenner is quoted to have said, "I hope that someday the practice of producing cowpox in human beings will spread over the world. When that day comes, there will be no smallpox." And that actually happens in 1980. But there were many problems with the global program beforehand. So in 1959, the WHO actually implemented the first global program for eradication. However, there were three main problems with that. It was vastly underfunded, there was a lack of cooperation between countries, and there was a lack of equitable vaccine distribution. This made it so that containment wasn't really possible and it didn't really work. However, in 1967, the WHO created a renewal program instead, and that made sure that it was the vaccine was much more distributed and it got more funding so that individuals that actually needed the vaccine could get the vaccine. They also started a technique called ring vaccination, which meant that you would vaccinate exposed individuals. That meant that only the individuals that were actually exposed to individuals that had smallpox would get the vaccine. And that made it so that you didn't have to vaccinate every single person in the globe. You would only have to vaccinate the individuals that were at risk, which made it so that the disease could still be contained very efficiently using less resources. They also emphasized vaccinations in third world countries so that global containment could be achieved. And the efficient bifurcating needle technology made it so that it was much more efficient to vaccinate individuals. So the main takeaways from smallpox eradication program are these three. One, we should fund vaccination and surveillance programs everywhere, not just in first world countries, but third world countries as well. Because in order to get global eradication and global containment, we need to make sure that every single person within the globe gets the vaccine that they need. It's important to also survey and make sure that the individuals that need the vaccine get it, and that the vaccine is working, and that the program is working. We need to make sure that we track who gets the vaccine, and if it's working, and if the individuals that the program is working, and that the number of cases is going down. In order to do that, we also need to increase access to diagnostic tests everywhere, because as we know, sometimes there's asymptomatic cases for COVID, and that makes it so that you can't really detect if you have the virus unless you take a test. So if we increase access to diagnostic tests everywhere, then we can make sure that everywhere in the world is tracking the COVID very closely, and that we know that everyone that needs the vaccine is again getting it, and that the program is working, and that cases are going down. And then finally, we need to make sure that we develop and spread clear public health messages, because we need to make sure that everyone in the globe understands the importance of vaccination as it was in the smallpox pandemic, and that we make sure that everyone understands that if we get containment, vaccination is always a must. So in conclusion, it did take 184 years to eradicate smallpox. It did take a long while, but that is because of all the mistakes that were made. If we learn from the past mistakes and improvements, then we can always contain COVID-19. It is challenging, but it is possible. If we take the strategies that we learned from smallpox, we can definitely achieve it soon. So thank you so much. If you have any questions, you can contact me on my email or my Instagram.